Hi, I'm Dr. Satish Nair. I'm an ENT and head and neck surgeon at the Apollo Hospital Karnataka, Bangalore. A good sleep is important for a healthy body and mind. In today's world, to find good sleep seems to be getting more and more difficult. There are a group of patients who come to us telling us that we do have a good sleep, we sleep all the night, but we don't feel good in the day. And the relatives and the people who are with them keep coming to us and telling this person snores. Snoring seems to have become almost like a common thing now. It's more of a lifestyle problem. A lot of people, earlier we would see a very obese person or an older person snore. Now we have people who are in the age of 20s and 30s who come back snoring. So what is the snoring? When air travels through the nose into the lungs, it goes through various areas, and if it has an area which is narrow, as we know when air travels through narrow areas, it pulls things inside. The pressure increases there and it pulls it inside. So if it's a collapsible area, it will collapse. If it's a non-collapsible area, it will maintain to stay like that. So as the air goes from the nose back of the nose, as it comes down behind the soft palate, that small tongue that you see above the tongue, and goes down, the area which is collapsible is the soft palate. So we can see that in that area, if a person has large tonsils, large soft palate, in these people, the soft palate, the area between the soft palate and the back wall becomes small, causing narrowing of the area and increased pressure. And the soft palate keeps flapping. This flapping sound is a sound of snoring. Social problem is one side which may require treatment if the patient wants, but there is another condition called obstructive sleep apnea. Means obstruction causing sleep apnea. Apnea means no breathing. Some of these patients with snoring, they snore and in between they go to a state where they do not snore, total silence, and they again start snoring. During that particular time, what happens is that soft palate which I was talking about gets so blocked that it locks like a vacuum and prevents air entry inside. The patient keeps trying to breathe in, but he's not able to breathe in. Snoring stops, but he keeps trying to breathe in. If it happens for 10 seconds, it's called one apneic episode. In the 10 seconds, a lot of things happen, which is the crux of the matter. When you sleep, you have an oxygenation of 100%, maybe your pulse is around 70. In the 10 seconds, the oxygenation drops from 100 to 90 to 80, 70, 60. With every percentage drop, 10% drop, the brain wants its oxygen. How it gets it? It makes the heart beat faster. So as it goes from 100 to 90% oxygenation, pulse rate goes from 70 to 90. You won't believe it that if you test yourself during these apneic episodes, people can go to heart rate about 140 to 160 beats per minute. That means something which is very difficult even in a daytime after jogging on a treadmill. So the heart is being told in a second to get back and pump so hard and again come back. And as this goes on decreasing, within 10 seconds, the brain understands that the person is not going to wake up. The person is made to wake up by the brain. So the person makes a sudden movement in sleep and the obstruction goes away. Muscles contract, obstruction goes away, and the patient starts breathing again and again snoring. So this has effects on the heart and also on the circulation or our blood pressure. The patients with apnea usually would come with early morning headaches, not feeling very comfortable even after sleeping for 8 hours in the night, excessive daytime sleepiness. Wherever you sit down, in another 15 to 20 minutes, the patient goes to sleep. Young people with hypertension, not being able to treat it with medication. And there are multiple other symptoms that are present along with it, including social and psychological issues. So how do we come to know the patient has an apnea or a snoring? A sleep study is a gold standard to identify obstructive sleep apnea. A sleep study is one in which you go and lie down at a particular sleep lab where various parameters are evaluated over the night, and in the morning you get a report of how many apneas you had, what was your blood pressure, how much was your heart rate, etc. And if it is a moderate or severe condition of obstructive sleep apnea, the doctor would suggest you to undergo some treatment. So like I said, snoring was a social problem. Now we have come to a medical problem called obstructive sleep apnea. The treatment can be either a medical way, that is use of a CPAP or a BiPAP machine. It's a machine that's covered on the face and you sleep with a mask. It pushes air through your nostril and keeps that area open, doesn't allow it to collapse. The other method is to go for a surgical method in which the areas which have collapsed or the areas which are narrow are widened. For example, the tonsils, the soft palate, etc. is widened so that the airway becomes better.